Welcome to the Iowa Geriatric Education Center's resource page for persons caring for an individual with Alzheimer's disease or related dementia. If you are a caregiver and experiencing problem behaviors such as aggression, anxiety, restlessness, or depression, you are likely looking for some assistance. Although problem behaviors are not a normal part of Alzheimer's disease process, they can be a common occurrence. It may help to know that there are many things you can do to prevent and/or manage them. Behaviors associated with Alzheimer's disease are generally the result of something in the person's environment, frustration with communication, or an unmet need. This resource page is designed specifically to stress the prevention of difficult behaviors and to provide much needed information to avoid the use of medications, specifically antipsychotics, to treat difficult behaviors. On this site, you will find resources to help you understand and implement preventive measures for common behavior problems. Our number one recommendation is to learn to recognize and prevent situations that may lead to unwanted or difficult behaviors before ever considering administering a medication to your loved one. Much information on managing behaviors is available via the internet and organizations such as the Alzheimer's Association. Therefore, we have provided just a small sampling of handouts and links that will help you to identify and respond to behavioral triggers. This information is found under the Resources for Managing Behaviors section at the top of the page. Prevention and/or management of behavioral problems should be your primary focus. Managing behaviors with medication should be a last resort, as medications have serious side effects and sometimes even create additional behavioral problems. However, in some cases, family members, in consultation with a physician, will decide that medication is necessary. Unfortunately, there is very little information available to help navigate this process. If this is your situation, you will find the following two videos titled Shared Decision Making on Antipsychotic Use and Antipsychotic Monitoring extremely useful as you weigh the pros and cons of using medication to manage behaviors. Again, we stress that medication should be the last path you choose. Shared decision-making on antipsychotic use will help you walk through a process of understanding when and why you may opt to use a medication, such as an antipsychotic, and explain the common side effects associated with such medications. Antipsychotic monitoring will provide useful information on how to monitor an individual once they have been provided a medication. It is very important to understand that once a medication is started, it must be monitored for both positive and negative effects. We thank you for taking the time to learn about the many preventive measures you can use to avoid common behavior problems prior to consideration of any medication.